Okay. Firstly, thank you very much for the time you're sharing with us tonight. We don't have an awful lot of time to discuss, so I'm going to really rush through this, which I hate to do, to be honest with you, because this is such a deep and important issue. The first thing that we believe as the Green Party of Ontario is that when discussing issues, it should be done by somebody who is of that community. And so to begin with, I am not just a senior rights advocate, I am a human rights advocate who is also a senior. I'm a user of these services. I live with a disability, and I have in the past had to rely on social assistance, all of issues that have been raised earlier today. And so that's an important, different distinction about how the Green Party goes about things. We're not partisan. We don't engage in demonization, but we do believe in core philosophies that the decisions about elder care and elder life in general, because let's face it, I'm a senior and so too is my mother, and we both have slightly different needs, and we're not quite ready to pack it in just yet. Thank you very much. And so I'm a big believer that we need to keep a weather eye open for ageism, which I believe is at the root of many of our issues. Up here on one side, I designed the CARP benefits program some time ago for the Canadian Association of Retired Persons. I worked in the insurance sector, and this was the largest private health insurance plan of its type. So I understand the mathematics behind what we're discussing here. And I'm also a past director of the Senior Pride Network, where we identified many of the issues that we see today 5, 6, or even 7 years ago. And we begged the government of that time to address those issues, not least of which is the proper compensation and respect for personal support workers, but also proper regulation and enforcement of those regulations in long-term care. As a former insurance industry executive, not only do I know it is compassionate to provide opportunities to age in place. I live in a co-op right now, and we have a very active aging in place program. Not only do I know that it's compassionate, but I also know that it makes sound economic sense. And we in the Green Party have a history of being able to convince people, even people like Doug Ford, that if we can do things that make good, we can do well by doing good. In other words, we can sell whatever government, whether it's a coalition with my friends here from the Liberals and the NDPs and the Green providing the moral compass, or indeed, if we face another 4 years with the Ford family, we've demonstrated that we can shift the thinking, not by playing partisan politics, but by engaging in basically selling the ideas that it can be economically sustainable, environmentally sustainable, and socially sustainable. I'm committed to doing that. I've been committed to doing this for the past, even before I was a senior and had a significant stake in this program. I'd like to add too that we do have a fully costed out
exactly 3 minutes.
A fully costed out platform, which I am not going to go into, but I will put a link in the chat, maybe if that would help people at a later stage. So thank you very much for the opportunity.
Okay, thank you, candidates. Now you're gonna have 1 minute each of you to speak to the questions that are going to come up. We have Brenda is gonna ask the first question. And each one of you has got 1 minute to answer. Thank you.
Thank you. Here's the question. How does your party plan to address the issues in our healthcare system that impact seniors, such as wait times to see specialists, insufficient interpretation services for seniors accessing hospitals and services, and medical bankruptcy? That's the question.
Thank you, Brenda. And I will ask Kate to go first when Tohida is ready to time it.
Yeah.
Okay. So the Ontario NDP is committed to fully funding and supporting our public healthcare system and ensuring that the last 2 decades of cuts to our systems are addressed. So we know, I am one myself, healthcare professionals have been leaving the system, right? That's making wait times longer for all of us. So we need to not only hire more healthcare workers, we need to pay staff what they deserve so that they will be retained here in Ontario. The number one thing we must do is repeal Bill 124 to ensure healthcare workers such as nurses are being fairly compensated for the hard work they do. We commit to providing culturally inclusive healthcare, ensuring a very person-centered approach to care, that is respectful of people's preferences, backgrounds, their language. We know so many seniors are struggling right now, right? They have to pay for dental work. It's so expensive. Medication. We hear stories of people skipping a pill or cutting their pills in half. The Ontario NDP is committed to bringing in universal pharmacare and
Time is
dental care.
over.
Thank you. Wow.
Thank you so much, Kate. And Nicki, would you like to begin? And also, you're allowed to finish your sentence after the time.
Okay.
If you
I was not
You
finished.
should
my
finish.
sentence.
Let her finish the sentence. I'll wait a moment.
All right. I just want to say we are committed to bringing in universal pharmacare and dental care here to Ontario to ensure no one has to make difficult decisions about accessing care or go into debt to get the care they may desperately need. Thank you.
And Nicki, you're welcome to begin.
As part of my history as a human rights advocate, I've worked on enforcing the Canada Health Act and the duty to accommodate to provide healthcare services for people in need. So the question that has been posed is very broad and has multiple components to it. But I will tell you the how. How do we get this done? How do we get this done in the event of a coalition government, or in which case the Green Party will do what it's always done, provide the moral compass and the moral certitude to provide practical solutions. In the case of another form of government, similar to the Ford government, we will convince them using the carrot that this is popular, socially responsible and good for getting votes, and also that using the stick, which is the Canada Health Act, and the fact that seniors are a protected class, meaning that they cannot be discriminated against. It's a law. It's unlawful to discriminate against seniors, and yet the federal, provincial, and indeed municipal governments regularly do it. So how do we convince people to do the right thing?
That's
First, the
exactly
carrot.
1 minute.
Well,
But you
firstly, we convince them that it's the right thing to do and it's a good way to get votes. And secondly, we show them the economic reality that this is actually investing in people. It's not a cost, it's an investment. It's much, much cheaper to help people in homes than in a hospital. Much cheaper.
Thank you, Nicki. And Rochelle, you're welcome to begin.
Thank you. Just as Nicki mentioned, it is actually much more cost efficient to care for folks in community and in their homes. And the question around surgery backlogs and specialist appointments that so many seniors are waiting for, the Ontario Liberal Party is committed to investing in an additional 100,000 healthcare workers in order to deal with the exodus of healthcare workers from the pandemic that we know is happening in stark numbers, as well as to manage the surge of 100,000 backlog surgeries that have also been aggravated by the pandemic, but were a challenge before the pandemic began, and certainly were not only the making of the current government, but actually all governments have had a role in the current system that was under strain and under stress before the pandemic. And so 100,000 healthcare workers, as well as core investments in primary healthcare in communities, including 15 new community health centers that include interpretation.
Okay, thank you, candidates. And now I will move on to Jackie. Jackie is a personal support worker, and she has a question about the personal support workers in home care. Jackie.
Thanks. Thank you, Connie. Home care workers are paid considerably less than other healthcare workers. Not only that, our hours of work are precarious and our pensions are non-existent. We love our work, but this is no way to build a first-class home care system. With the dramatic shortage of healthcare workers right across the province, many home care appointments cannot be met. The question is, how will you work with us to make significant improvements in wages, pensions, and working conditions for home care workers?
Thank you, Jackie. And Nicki, would you like to go first for this one? When you're ready, Nicki, if you'd like to go first. Oh, it's not working?
Yeah. Can you hear me now?
Yes.
Yep.
Okay, thank you very much. Well, it's very forthright of my colleagues to acknowledge that this is a problem that even predates Doug Ford. And I've had personal meetings with folks, former health ministers, to push this through. Once again, we come down to the root cause that elder care or taking care of folks of a certain age is not viewed as important. Those who are older are regarded as second-class citizens, and those important, vital people who provide care for those who are aging are viewed in the same dismissive light. PSWs are professionals who should not be forced to work a gig economy on a part-time basis, to have to doubt whether they can get health benefits or dental benefits. It's perverse, it's morally reprehensible, and it is extremely expensive. As a former financial person in the insurance industry, I can tell you that a single visit to the hospital is measured in thousands of dollars. And the fact that the current government and previous governments have squabbled over $3 here, $4
1 minute
here,
left.
$3 here, $4 there is not just immoral, but it's economically insane. And it has to stop. And we can convince people, regardless of whether it's coalition or Ford, we can convince whoever is in government if we are a part of it. That's why we need to vote more Green MPPs in place.
Thank you so much, Nicki.